Okay, I'm going to continue to push out educational videos on the flu shot because here in Massachusetts, as people know, or some people don't know, the governor mandated the flu shot for children starting at the age of 6 months, just a little baby, all the way up to college years. And if they don't get it and they don't have an exemption, they get kicked out of school. Imagine that. Now, this is unprecedented. It's never been done before. And if we follow suit with this, the rest of the states will follow. So if you're not in Massachusetts, you need to pay attention to this too. And you should be fighting for us just as if we are fighting for you right now. The problem is with this is that the governor is using fear as a weapon. He's using fear as a weapon for people to take the shot. The reasons why he says that he wants you and your kids to get the shot is because he wants to prevent the twindemic for two things happening at the same time, from the flu and the other virus. Well, there is no evidence that the flu shot decreases hospitalizations in people. There's no evidence that it will do what he's saying that it will even do. So that's unprecedented that he's basing this on a hypothetical hypothesis that is not based in science. He creates fear because he needs to use that fear for people to get the shot. And if you are prone to responding to that emotional response when you're fearful, then you are going to be the victim. Your friend is going to be the victim. Your family is going to be a victim. We cannot live in fear. We need to be strong, and we're only strong when we stand in our power. But when we move away from that, then we become fearful and we make horrible decisions. So please don't respond to the fear mongering. I took a course on the actual influenza shot, and I'm going to talk about a few things that I've learned. And some of the things that I learned actually surprised me, because I've been a nurse for 23 years, and I've never heard some of these things I'm about to tell you. So children with asthma who would receive the shot had 3 times increased risk of hospitalization. There's no evidence that the influenza shot prevents pediatric asthma exacerbations. Actually, it made it worse. In children with cancer, it remains unclear whether the antibody protects them from the influenza infection or its complications. And it has a low effectiveness against preventing clinical influenza. I also have some documents from the UCLA case because they tried to mandate the flu shot for the UCL students and the staff. So I'm going to read a little bit about what I have here from the Superior Court of the State of California for the County of Alameda. And this is by a doctor, Peter Gochis. And I don't know if I'm saying his name correctly or not. But here is his testimony. He has been a medical doctor in the medical research for 45 years, and he has personal knowledge of all of this information on the flu shot. So in 1993, he co-founded the Cochrane Collaboration, which is a collaborative effort by patient scientists and researchers around the world to evaluate medical research to assist patients, health professionals, and policymakers to make better decisions. So with some studies that you'll read, they're being paid by like the manufacturers, or they're being paid by somebody else. So this is a neutral collaborative effort that they do are not getting paid. They do the research and they do it in truth. So during the 25 years, he worked with the Cochrane Collaboration, and the group has published over 10,000 systematic reviews and protocols for upcoming reviews on the benefits and harms of interventions used in healthcare. So not just shots. All right, so he also wrote a book because of his concerns. It's called Vaccines, Truth, Lies, and Controversies. The book was published in Denmark, and it been published in many different languages. Hold on, Shane, I'm almost done. So this is what he found out. The efficacy and public benefit of the flu shot is so questionable that it should not be given routine to healthy adults. So they focus on adults, and I'm just going to throw in the kids here too, because I'm sure that's what it is also. His general conclusion is that the recommendation in some countries that healthy adults should take the seasonal flu vaccine is not supported by the medical literature, despite the American government agencies like the CDC's enthusiastic support for giving the shot to healthy people. Shots for preventing influenza in healthy adults was based on randomized clinical trials and comparative studies assessing serious and rare harms. So they found that there was no evidence the vaccine prevents viral transmission or complications, and that inactivated shots caused local harms in an estimated 1.6 additional cases of Guillain-Barré per million vaccinations. The harm evidence base is limited. So the more people that get the shots, the more adverse reactions and harm you will see. And this will happen. Make no mistake about it. Okay, so the results review provide no evidence for the utilization of vaccination against influenza in healthy adults as a routine public health measure. So just a very bad public health policy. The study was quite disappointing that the shot did not decrease admissions to hospitals, and that's exactly why Governor Baker wants to force it on our people. This is the second time a study has proven that it does not decrease the hospitalizations. The executive order mandating the flu shot is based on a belief that it will reduce hospital bed usage. The belief is simply wrong, which the Cochrane review showed. Okay, there is convincing evidence that the flu shots can cause harm. It is a fact that flu shots can cause serious harm. And in my practice as a nurse, I have seen this. I've seen Guillain-Barré. I've seen people with neuropathies. I've seen people end up in wheelchairs. I've seen people with swollen eyes, swollen arms, not being able to move their arms for days. It's also been confirmed that the flu shot pandemics can cause narcolepsy, which is debilitating with very poor treatment. So again, they say more harm will likely the flu shot will cause more harm than good. And it will increase deaths from infection because public distrust in the authorities, and this is interesting, will be nourished by this ill thought through and totally inappropriate use of force. No one has any idea about the results would be of increased shot coverage for influenza on the risk of getting infected with C-19 and dying from it. But he was not optimistic that the results would be beneficial. For example, it has been thoroughly documented in many carefully conducted studies that the shot with non-live viruses increases mortality from other infections. So it just gets worse. His overall conclusion for the forced flu shot scheme is that it is deeply unethical, thank you, violates basic human rights, thank you twice, and is based in no reliable evidence whatsoever. Thank you 3 times. In fact, the best evidence we have tells us that the forced shot scheme is highly likely to be harmful. All right, so those are all things I'm going to go over for today. It's just really important to push this information out when you are deciding whether or not you should get a flu shot. Ask which one they're giving you, read the ingredients, ask what the side effects are, although they're not going to be truthful. You should be going over the package insert and look to see if you have any allergies under those ingredients. All right, everybody, take care, stay strong. I'm here for you. Have a good day.